Kia ora koutou, my name is Samora Kake. I come from the Burnett Foundation Aotearoa organisation. We are based all over Aotearoa. And bear with me, so this is a very rushed presentation on HIV, PrEP and PEP. Basically an update, some of you all may know, have an awareness of such. Oh, look at her. Okay, so my name is Samora Kake. A big disclaimer, I am not a clinician, I am not a doctor, nor am I a nurse. However, I have completed my Masters in Social Work. I've done some youth work and some health promotion where my practice has been amongst very much the hospital. All credit goes to Auckland Sexual Health Services, who I have done some ample foundation and study and I guess working with students when it comes to sexual health. And with Burnett Foundation Aotearoa, I am the Senior Services and Outreach Coordinator. So basically what that means is how do we deliver peer testing out in community? How can we support communities, I guess when it comes to HIV testing or STI, talanoa and so forth. This presentation is going to be hard and fast, so we'll allow for more time for talanoa and kōrero coming forward. Burnett Foundation Aotearoa, who were we for the last 40 years? We have been doing some ample health promotion and networking with the community when it came to AIDS. Formerly known as New Zealand AIDS Foundation, for nearly 40 years, we have been at the forefront for HIV and AIDS response in Aotearoa. In recent years, we have communicated to our communities through our social marketing branding, from ending HIV to some of the old campaigns they used to do, and that was our ticket into getting some funding from government and health resources. We've rebranded in 2022 to honour one of our pioneers to the AIDS response in New Zealand, Bruce Burnett. May he rest in peace, and he has been one of our ample our branding. Our new strategy launched in 2023 includes our new scope to care for the sexual health of all rainbow communities, and we now have centres here in Tamaki Makaurau, in Wellington and Ōtautahi. And these centres, almost sort of like clinics, but more centres, more safe spaces for our communities to come through and make that first step of testing before we kind of refer on to our sexual health providers. What is our kaupapa? Well, we do condom distribution. We send condoms nationwide to your letterbox or to certain clinics or sexual health providers. We also provide HIV and STI testing. Our most recent testing in this case would be the Insti test, a prick to the finger to determine within 60 seconds your result whether you are HIV positive or syphilis positive. We also provide counselling and support for people living with and affected with HIV. We do have contracted counsellors who are very competent, rainbow competent as well as navigating what it means to be HIV positive. Advocating for policy change that affects our communities. What this may look like today, some of you may have realised or noticed the Mpox outbreak. We are part of that policy and I guess working alongside New Zealand Sexual Health Society. We're here to support what policy change that might look like. Fundraising initiatives to support our programs and rainbow community organisations. We do have partnership initiatives in place, creating evidence-based behaviour change, social marketing interventions for our communities. What is that? That is very much our social media presence. And alongside formerly known as Te Whatu Ora New Zealand Health, or I'm not sure what they're called now. We work alongside for safe messaging. So especially with the Mpox, a lot of our youth are online, so we want to support that. And what does that look like? That is the awareness, the messaging, busting down myths and all those stigma affiliated with HIV. Strengthen community action through community building events such as Big Gay Out and World AIDS Day. Yes, Big Gay Out, one of our major events that we host every Pride February, Auckland Pride, and that's just a whānau space for rainbow organisations and other organisations and corporates to jump on board and give us their money. Combination prevention. Obviously, I do want to highlight for the past 40 years, condoms has been our main campaigner. However, with the introduction of PrEP and PEP, that adds just a little bit more of a spice, a little bit more of a, say, element to people's relationships with each other. Of course, we support our rainbow communities, but what that support looks like is the promotion of condoms, the promotion of PrEP, the promotion of PEP, and undetectable viral load. So that is for, I guess, our HIV positive whānau. And where we introduce U equals U, which means undetectable and untransmissible. Reflections on GP education tour. So in the last 2 years, just another disclaimer, I have only been working with Burnett Foundation for the last 2 years. However, my whakapapa with sexual health promotion comes from Auckland Sexual Health. To be able to join this kaupapa, I am honoured. The organisation, there was a PrEP roadshow. Some of you may have been part of that roadshow where they came and presented to you. Some of you may not. We do have some reflections, 25 in-person events across New Zealand, 1 online webinar. Doctors are time constrained, so these are the results we found out. Doctors are time constrained and already seeing a heavy workload. Training session attendance was a challenge. Online modules aren't well utilised. Low completion rates for online courses. We do have an online red seed, online modules. Attendees had an interest in sexual health already. So that was good. That was positive. That showed that there was already an interest. There was already kind of competency. Some good results we also found out. Doctors are good at navigating gaps in clinical knowledge. Tools such as BPAC, health pathways, well already utilised, and clinic resources and flowcharts are already available. The resources were there and you were already using it. That's a huge tick. But then afterwards, it came down to a few questions, one of them being how do we train clinicians to navigate moral or lifestyle objections about their patients? And I guess that does bring into kōrero, what do these conversations, when it does become to prescribing PrEP, prescribing PEP, how do we hold that space? How do we ensure that we are looking after our rainbow communities, after communities who may be in that D-low kind of identity or sphere or umbrella? We want to ensure that safe spaces are provided, especially within our GPs. They can have all the resources, they can have all the monitoring and prescribing pathways and whatnot, but we want to ensure that first kind of contact with our patients, are they safe? Are they well looked after? Or is PrEP even right for them? How do we hold that space moving forward? Is PrEP working in our community? So you can probably see from this graph, I didn't design this graph myself. However, there has been an increase. So we can see from 2015 to 2021, there's a slight decrease. It has kind of proven to us that at that time, maybe many weren't testing. However, we can definitely see an increase from 2021 to 2023 last year. Not scary, of course, but of course we need a test. We don't know unless we test, and we have found out that communities weren't testing, and we wanted to understand what those barriers were. So we're slowly kind of picking things back up. If we get more HIV positives, that's okay. It just shows that there's still more work to be done. PrEP. So for those who don't know what PrEP stands for, PrEP is the pre-exposure prophylaxis, the use of antiretroviral medicines to prevent individuals acquiring HIV who are at high risk. There have been a number of well-conducted medical trials that have been proven the efficacy of PrEP within greater than 95% reduction in HIV acquisition and GBM and elevated risk of HIV. In New Zealand, we use a dual formulated tablet. I'm not going to attempt to say that, and yes, 200 milligrams of that. PrEP is fully funded on the pharmaceutical schedule, and we estimate 6,000 people would benefit from PrEP. So you all know what PrEP stands for, you all know what PrEP is used for. PrEP can only be prescribed to those who are HIV negative. If they are HIV positive, they do go on to further treatment, and you all know where you can get that information. Also, we just want to mention, we do have an awareness that PrEP in Australia is also being injected as well. We're not quite at that point yet, but we know that a lot of our patients do come in and think, oh, I heard they're getting injected, maybe we can too. But it's kind of like still in the process of what that looks like for us here in Aotearoa. PEP. So we've got PrEP, pre-exposure, and then we've got PEP, which is post-exposure prophylaxis, refers to the use of antiretroviral medicines to prevent HIV acquisition after a person has been exposed. Sort of like your emergency contraceptive, your emergency HIV pill. This presentation discusses non-occupational PEP. PEP must be started within 72 hours of the HIV risk event, and the closer to the time of the event, the more likely it is to prevent HIV. Any request for PEP should be triaged as urgent. So maybe some over-the-counter PEP requests, it's down to your receptionist or your GP and on what kind of risk that looks like. I just got the 5-minute curtain call. Aroha mai. Lab testing considerations. PEP medication is urgent. PEP is used for some sexual exposures, can be MSM, men who have sex with men, or heterosexual. Needle stick and occupational risk pathways differ. See Awanui training guide for these. PEP blood tests are not urgent by definition, and PEP is dispensed based on exposure risk. So this kind of wraps up my kōrero around what safe space looks like in your I guess, clinics or in your places of practice. And I must say, we do have patients or clients who come through to us and still disclose with us that I'm not really safe to talk to my GP around PrEP. And it could be a lot of things. There could be a bit of stigma. There could be just the ongoing relationship with our GPs that it's kind of like, this is kind of like a new level, and whether they pass it or not. But with Burnett Foundation, we're always aiming to support our GPs and our whānau, and what it means for our Takatapui communities, what this means for our MVP FAF Plus communities, who are our Pasifika rainbow communities as well. A lot of our communities do hold space, do still go to church, still are very much close with their families, or maybe in other cases still married. And I guess that comes to how we hold space as clinicians, as practitioners, as professionals in this day and age. So I would like to open the floor. If you have any questions, disclaimer, I'm not a clinician, but all questions are welcome.